The following educational video was created in collaboration with the Faculty of Biomedical Engineering of the Czech Technical University in Prague and the First Surgical Clinic of the General University Hospital. Administering medications is one of the common activities we perform multiple times a day, based on the indications and prescriptions from a doctor. Storage of medicinal products. Medicinal products are stored in their original packaging or packaging from the pharmacy, which are labeled with the product name, batch number, and expiry date, and in lockable pharmacies. An exception is made for emergency medicine, where medicinal products must be secured against misuse by unauthorized persons. Medicinal products are stored according to their dosage forms. Medicinal products for internal use, including tablets and injections, are stored apart from those for other uses, such as ointments and suppositories. Medications must be stored at the temperature specified by the manufacturer. Medicinal products containing addictive substances are subject to controlled substance records and must be stored in lockable, non-portable metal safes. Look-alike, sound-alike, LASA. Medications that have similar packaging or names that sound alike present a risk of being confused with one another. Medicinal products that only differ in the amount of active ingredients must also be stored separately to minimize the risk of confusion. High-risk medicinal products. High-risk medicinal products include concentrated electrolytes, insulins, and heparins. Concentrated electrolytes must always be stored separately from other products in a lockable cabinet and clearly labeled as concentrated electrolytes. Insulins must be stored separately in a distinct compartment, clearly marked insulin. Heparins must also be stored in a separate compartment, marked heparin. Medicinal products intended for oral use should always be given from their original packaging using a medication cup. When only part of a tablet is administered, the remainder must be disposed of in a container. When using tools to divide medicinal products, they should be immediately wiped with wet cotton wool and mechanically cleaned between uses for different patients. After administering medicinal products, a mechanical cleaning should be performed. After administering medicinal products, we disinfect, rinse under running water, and dry the tools. The same decontamination procedure should be applied when using a medication grinder. Key principles for safe medication administration include ensuring that the correct medication is given to the correct patient in the correct dose, using the correct technique at the correct time. Before preparing and handling medicines, we carry out hygienic hand disinfection and follow aseptic procedures. Medicinal products are prepared only from original packaging and administered based on the doctor's prescription, documented in the patient's medical records, and exceptionally on the basis of a verbal or telephone order. The doctor's prescription must include the name of the medicinal product, its form, strength, prescribed quantity, route or site of administration, and the time or time frame of administration. All medications we prepare must be thoroughly labeled with the patient's last name, date of birth, the medication used, and its weight or dosage. If the medication is prescribed as needed, we indicate the time of administration, and if applicable, the rate of administration. We perform a check of the prescribed and prepared medication. The person who prepares and dilutes the medication is the one who administers it. We prepare right before giving it, with full accountability. Never administer medications that you have not prepared yourself. The safest and most convenient method is to prepare the medication at the patient's bedside, as this minimizes the risk of confusion. Always verify the patient's identity, even if you know them well. Record the medication administration to ensure it is evident that the patient received the medication. We monitor the effect of the medication on the patient and any potential complications. In case of complications, we inform the doctor. Keep in mind that the most common iatrogenic damage to the patient occurs due to errors in medication administration. Always use the patient's medical records. Never administer medications from memory alone. Always identify the patient's identity, even if you know them well. Never administer a medicinal product that you have not prepared or witnessed being prepared. Never leave medications on a bedside table for the patient to take later. Never leave an open pharmacy or medication cart unattended.